Hello and good morning, everyone. My name is Cassandra Perez, and I'm a field representative for Congressman Lou Correa. Welcome to Congressman Lou Correa's Congressional Webinar Town Hall on Mental Health, partnering with Children's Hospital of Orange County. Before we begin our presentation, Congressman Lou Correa would like to provide a couple of remarks through a pre-recorded presentation. Give us a moment as we transition into the next slide.
Hola, hi, I'm your Congressman Luis Correa, addressing you from your house, Orange County, California, the 46th Congressional District. Wanted to take a few moments of your time to talk about a very important topic, mental health. It's part of us, it's part of our community. It touches us, touches our family, touches our neighborhoods. And it's something that we don't talk about enough. For hundreds of years, we didn't even want to address mental health. It was only till the last 20 years that we started talking about mental health as it should be talked about, which is a medical issue. In years past, if a family had somebody that had mental issues, you would put them in the back room of the house. You wouldn't talk about that person. You would try to ignore them, try to hide them. It's only until lately that we figured out that mental health is a medical issue. Look around us today. Homelessness, people having trouble with drug abuse, alcohol abuse, broken families. You know, every time I walk down the street and I see a person who is essentially homeless, talking to themselves, arguing with themselves. And if you listen very carefully, you can hear the sounds of desperation. We in society are clearly addressing this. But the real solution starts with each and every one of us as individuals. How do we take care of ourselves, of our depression, of our happiness, of our family's happiness, making sure that that family member that we kind of lost touch with are brought back into the family. How do we take care of them? And sometimes we can't do it ourselves. I remember a while ago walking door to door. I met this wonderful man. Started up a conversation with him. And before I could say anything else, he said, "I want to know, sir, what you think about mental illness." And then as he started talking, I realized his great burden. His son, who had had early in his life mental challenges, mental health challenges. His son had turned to drugs. The father, not knowing where to go, had turned him over to the criminal justice system. Hadn't worked out. When he was speaking with me at that moment, I saw his son out of the corner of my eye. I could see that his son was heavily sedated, but living at home with a dad. And the only thing that father asked of me was, "Can you please make sure that our mental health system has the resources so that I can keep my son living with me here at home, so that I can care of my son, so that I can address my son's daily needs?" I learned that a very important lesson that day, which was we all need to work together to make sure that we address mental illness, not only in our immediate family, but in our communities. Today, we're going to have a great presentation by CHOC, Children's Hospital of Orange County. And at the end, we'll talk about some resources we can turn to get additional help. I'm happy that in California, mental health insurance coverage of needs of mental health are now a reality. We're going to continue to work on this issue at the federal level to make sure that insurance, both public and private, cover medical care mental medical care to make sure that all of us can have more productive lives. Thank you very much, Su Congresista Luis Correa, and let's get busy healing and taking care of our communities. Muchas gracias.
Thank you, Congressman. And now we will move on to our presentation. So give us a moment as we transition back into our slides. So this morning we have the pleasure of being joined by Dr. Heather Husey. She is a licensed psychologist and chief psychologist at CHOC, as well as the section chief for pediatric psychology. Welcome, Dr. Husey.
Thank you so much, Cassandra, and thank you to the Congressman for highlighting this important topic. So today I'm going to talk a little bit about the mental health effects of the COVID-19 pandemic on children in particular, but I'm going to talk a little bit about the effects on adults also to start with. If I can have the next slide. So I think we've all experienced this, right, over the last couple of years, and I sort of felt like this encompassed it of like, oh my gosh, we had such hope for last year, and gosh, it was just seemed like more and more focus on the pandemic and things we couldn't do, and gosh, 2022, you know, same kind of start. So I think we sometimes feel like we're a little bit in a loop of what's going on, and that really can lead to a lot of mental health effects, both on adults as well as on children. Next slide. So as we look at, are we seeing increases in depression, anxiety, thoughts of suicide in the population? The answer to that is yes. During the pandemic, we have seen increases. So this is looking at adults. It's a survey that's done every couple of years. And what we found is looking at 2018 as compared to 2020, we saw an increase of a doubling of adults who said, yeah, you know what, in the last month, I've had thoughts of suicide. We've seen 4 times the rates of depression in adults, and we've seen 3 times the rates of anxiety. These numbers were taken during that first year of the pandemic, and unfortunately, we haven't really seen a decrease in the numbers since then. And one of the striking things about this sort of pulse, if you will, of what is the kind of mental health effects going on in the population is that the effects seem to be greater amongst younger adults. So almost 80% of young adults ages 18 to 24 had at least one behavioral health or mental health symptom during the survey time. Next slide, please. So we've also seen these same effects on children. A study just came out from UNICEF looking at what's happening to children in the world. And they're finding across the world, about 20% of children report feeling often depressed during this pandemic. And their estimate is 1 in 7 children worldwide are affected directly by the pandemic in terms of their mental health symptoms. And in one country, they had 1/3 of children reporting anxiety and fear. And they estimate that the costs worldwide to the pandemic in terms of mental health effects were $390 billion per year. So, you know, I think sometimes we think about, gosh, just feeling down, does that really affect a lot of things? But it does. It affects productivity, it affects academic performance, it affects a lot of things that do have economic costs associated with them. Next slide, please. And it's no different here in this country, which was a part of the UNICEF survey. In October, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association declared a national emergency in children's mental health, just looking at the toll of children's mental health problems on top of the toll of the COVID pandemic. And then following in December, the US Surgeon General also issued an advisory on youth mental health care, again, citing the challenges that youth were facing and that are being expressed in feelings of hopelessness and depression and anxiety and thoughts of suicide. And I think, it is sometimes shocking to us when we learn that rates of suicide in children have gone up over the past decades. And right now, it's the second leading cause of death in children 10 to 14 years of age and 15 to 24 years of age. And those are really preventable deaths, and deaths that we feel like with improved mental health access, with improved care, that we really can make a difference in the lives lost from mental health concerns and from suicide. Next slide, please. And we're seeing these effects from COVID in children's mental health here in Orange County as well. So when we're looking at that year, so when you see fiscal year 20, that's the year in which COVID occurred, and then compared to last year, what we find is a 27% increase in children coming to our emergency department at CHOC with psychiatric emergencies, a 23% increase in children who were hospitalized for medical concerns, but also had mental health concerns. And about a quarter of those were for children who had suicidal ideation. We had 108% increase in the number of children hospitalized due to their eating disorder and needed medical stabilization. So it was so serious, they needed medical intervention. We saw a 28% increase in our volume for our intensive outpatient program, and a 71% increase in calls from the community looking for services for their children. So taken all together, we really can see that during this time of COVID, we've seen a pretty rapid increase in mental health concerns for children that actually were already at a heightened level prior to the start of the pandemic. Next slide, please. So I think one of the questions I get asked all the time is, so how long is this going to go on? Like, if we could just get back to normal, would all the effects go away? And sadly, our best belief is that no, they're not going to go away just like that. Looking in the literature, when you look at disasters that have happened in communities, and really can kind of think about the pandemic as an even bigger widespread disaster, what we find is anywhere from 3 to 5 years after the end of the disaster, children still have mental health effects. In China, after an earthquake, when they looked 3 years later, they found children still had high levels of depression, as well as post-traumatic stress disorder. And those children who did not receive mental health interventions had 4 times more likely to have that long-term post-traumatic stress disorder. And in Germany, looking at a dam break, they found that almost half of children had symptoms that stayed with them 3 to 4 years after the event, with 4 times greater. When we say somatoform disorder, that means things like stomach aches, headaches, that don't have an underlying physical cause, and 4 times greater rates of anxiety. So we kind of expect to see some of the same things happening here, which means that this is an after effect of the pandemic that we're going to be dealing with for some number of years. Next slide, please. So why is that? What are some things going on? Why do we as adults feel overwhelmed and more depression, more anxiety, and what are our kids experiencing? And so one of the things that we look at is that idea of surge capacity, right? In our sort of biology, right, as we learn to survive, is we have systems in our body that when there's a short-term kind of, crisis, and I think we've all experienced that in the past, right? Like, okay, I'm going to get myself together, and by gosh, I have increased energy, and I can do it, and I can add more and hang on. But usually those surge capacities are things for hours, days, maybe weeks. But this has gone on over 2 years, almost over 2 years, yeah. We're heading into our 3rd year. And that stretches way beyond our ability for that surge capacity. And once that's depleted, and once that sort of, all right, I can get out there and get it done, is gone, we need to renew. And where have we had the time to do that? And I think we're all probably experiencing that moment of like, I just want to be normal again. I just want to go out and do these things. And that's kind of our body and our mind saying, you need to get some renewal, some rest, some recovery. And so if we're not yet to recovery, then how do we cope? So I'm going to offer up some suggestions and things that you can do, as well as help with our children on. But I'll just note that this sort of bringing yourself to recovery is hardest for those of us who are overachievers, those type A personality, and those people who like to problem solve. So that's probably everyone on this call or watching this presentation. And so just know, if you're struggling, so are others in the community. And I think the other thing is there's a lot of ambiguous losses, right? There's a lot of losses we can point to, but that sense of community, that sense of what have I missed out on that I would have been doing if the pandemic hadn't occurred, also can lead to those concerns and add to that sense of depression and anxiety. So all of these things can contribute to the feelings that we're having. Next slide, please. So I'm going to talk first about what are some things you can do, because when we're trying to help children in our lives, if we're not centered, the children around us pick up that stress, right? Children are exquisitely attuned to what's going on with their parents, what's going on with their teachers, anyone important in their lives. And when we struggle, kids will struggle more. So one thing is to really understand that these kinds of feelings that we're having are actually normal feelings in an abnormal situation. That exhaustion, that depression, that anxiety, that I just want things to be normal, are all the things that so many of us are experiencing. The fact that it's hard to get things done, or that some mornings I wake up and I'm just like, oh, I can hardly stand to think about what the day brings, is give yourself some grace and give those around you some grace of, these are abnormal times. We have more on our plate. We're trying to juggle more. We're uncertain about what's going on, and that's very difficult for us as humans to deal with. So really focus at what you have managed to accomplish, and maybe lower expectations a little bit about what can I do and what can I let go as a part of my trying to bring some renewal to myself. And then give those around you that grace and forgiveness as well. My mantra these days is, we're all just doing the very best we can, again, in a very abnormal situation. And so how do I forgive myself, forgive others around me? I think all of our nerves are at the end, right? And so when we sort of look around and go, wow, we're so quick to get angry at each other and snap at each other, a lot of that is just the stress and pressure we've been under. So giving ourselves some grace and saying, we're all there. And maybe I need to take a step back and do some of those renewing kinds of things for myself. Next slide, please. So what are some approaches? Well, one is what we call radical acceptance, which is that, what, I don't like it, it stinks, and this is where we're at right now, and I can accept that. I think sometimes we fight against it and just like, okay, if I just fight hard enough, I can bring things back to where they were before this all started. And the bottom line is things have changed, things are different, and I need to start to accept that. Also that both and thinking. So that idea of being, I can both need to give myself a little rest, and I can be working towards a goal at the same time. Those aren't mutually exclusive. It can also be things like, what, I can maybe loosen up a little bit on some of my rules at home for my kids, and I want to keep a structure for the children as well. I can hold both of those things together. Engage in activities that fulfill you, and those are both the old things that I like to do pre-pandemic, but also what are some new things that I've learned during the pandemic. I certainly have seen lots of people have gotten into jigsaw puzzles, taken up running. I've painted, started painting. So everyone has those things that really give you a sense of like, oh, this is fun. I'm having a good time. Finding ways to maintain important relationships. We are social creatures. So how do we get that support from our friends, from our family, and how do we give that support? And those are just, it's just such an important thing. Share your struggles. I think we can all have reflect on those times when, you know, we may have taken a risk and said, "Oh, I'm really struggling with, you know, not having gone to a restaurant for a long time," or my kids, you know, when I was trying to be their teacher as well as doing my own job, and that you had someone that you knew or respected who said, "Oh, me too," and you can really come together and support each other in those struggles. So you know, take that risk, share those struggles, because there's something about lifting that burden, right, when we share it. But also, it's okay to share your wins, and they can be little wins, you know, things like, hey, you know, I finally got to cleaning out this room, or I tried a new recipe for dinner. Those can be, you know, again, very uplifting, right, and have other people go like, yay, with you. And then this is one of those things that is seems so simple, but it's so hard when you're stressed. But we know biologically when your sleep is disturbed, when you're not eating healthy, and when you're not being active, that stress, depression, anxiety is more likely to occur. So if you can really try and watch, like, am I trying to get good sleep? Am I trying to eat healthy meals? And am I working activity into my daily life? Next slide, please. So what are some things that you can do to help children? So I'm going to run through a couple of these, and then we're going to practice the first two, deep breathing and grounding exercises. So deep breathing is what it sounds like. It is taking deep cleansing breaths. And sometimes that seems like a really simple thing, like, how is that going to help me? But we're going to try it together, and it really can be a very cleansing thing, and actually physiologically lowers the stress hormones that are cycling in your body, because your body's sort of sending out hormonal messages, if you will, that says to the organs and your brain and other places in your body, hey, things are okay. We can relax a little bit. It enacts that relaxation part of our body. Grounding exercises are things that you can use when you have that moment where you're like, I'm just so anxious, I can hardly think of anything else, and I just can't get my mind off of that. It's a way of bringing yourself back into the moment, right? Instead of running so far forward. And it can, we'll practice what those things can be in just a minute. Numbers and naming is another way to kind of get out of your head. So one way is counting backwards from 100. You can do that by single digits, or if you really want to give yourself a challenge, by threes. And that's so challenging that it takes all of our attention to focus on, and it lets us let go of some of those anxious thoughts or those depressive thoughts, those things that rattle around in our brain. Or naming, you can look around the room and say, okay, can I name all the things that are green? Or can I think of, go through the alphabet and think of an animal whose name starts with the letter. So you start with A and then B and then C. Sensory tools are things for people who are kind of like I'm more physical. And so those can be fidget toys, those can be things, stress balls that you squeeze. And you can talk with your child's teachers if you find something that works for them, and say, can my child have this at school? Like, put in their desk. But what we find is, again, occupying that channel, right? That feeling channel can reduce that level of anxiety. And what I'd encourage you, and I'm going to go through a couple more in a minute, is try these different ones with your kids and just say, hey, let's try a couple of little things. Tell me what works for you. What do you like? I'm not expecting everything's going to work for you, but I'm giving you a lot of different strategies because one of them is going to work. Next slide. Muscle relaxation is another thing that as we tense muscles and relax muscles, we start to train our body to understand what it is to relax. And I'll bet there are times when you might notice when I pay attention to my shoulders or my neck, I'll be like, oh man, there's a lot of tension there. And when I physically sort of say to myself, like, relax, I can actually release some of that tension. For kids, that's a little harder. So we do things like say, all right, imagine that you have a lemon in your hand. Now squeeze your hand as tight as you can and feel all those feelings in your arm and then let go of the lemon. And then what does that feel like? And now let's try that with our other hand. And so you can try things like that that are very kid focused. And there are lots of scripts on the internet. We call it progressive muscle relaxation. So you can look those up for kids, but you can just even try squeezing the lemon and releasing the lemon. Positive mantras work for some people. So finding that phrase that's really helpful for you. I mentioned what one of mine was a little bit ago, which is we're all doing the best we can. And just that helps me to kind of remember I'm doing my best, or if I'm irritated with someone, that they're doing their best, and kind of centers me and calms me. So find that mantra for your child. You can look up quotes, you can look up things that resonate with your family. And teach your child like, how do I kind of say that to myself? Scenery change. I think sometimes what happens is when we're anxious or depressed or kind of keyed up, that we just feel like I just have to power through and just like stay at this thing, and I get more and more frustrated. And sometimes it's just like put it down and walk outside for a minute. Just changing where you're at can actually bring you back much more energized and able to relook at the problem, right? When we just sort of stick in our minds when we're upset, we're not very effective problem solvers. And then technology prompts. So you can actually, there's a reason that on the internet people throw up pictures of cats or dogs or different pets, is that, there's a little bit of that endorphins that get released when we see cute things. So you might have your little cache of pictures. It might be your child as a baby. It might be little animal pictures that just make me feel good. It could be quotes. It could be positive emails people have sent you. But have your little cache together that you're like, I'm going to go to this when I'm feeling that way. Next slide, please. All right, so let's practice a couple of simple ones. This is deep breathing, and the bear's on there, one, because CHOC, of course, with our little bear, but also there's a great book for young kids called A Boy and His Bear that practices deep breathing. But the idea is, what I want you all to do is, a lot of times when we breathe shallowly. We breathe through our chest, and that actually sends a physiological message to your body that there's danger. Get ready to run, and it doesn't relax you. But when you breathe from your stomach, or more precisely your diaphragm and your epigastrium, you're filling your lungs, you're expanding your lungs fully, and you're giving a chemical message to your body that things are calm. And it sends those endorphins and those positive hormones through your body, relaxes your muscles, sends blood to our internal organs and away from our arms and legs where we're getting ready to run or fight. So the way you can see if I'm doing it correctly to take those deep cleansing breaths is put a hand on your chest, put a hand on your stomach, and try and breathe deeply such that the hand on your stomach rises, but the hand on your chest stays still. So give that a practice. And we're going to do this 4 times. Breathe in. Hold for a count of 4. 4, 3, 2, 1. Out. Then in. 1, 2, 3, 4. Hold. Out. 4, 3, 2, 1. And do that 2 more times. In. Hold. Out slowly. And then 1 more time. In. Out slowly. And you can see, even in doing that 4 times, that you can kind of settle your body down a little bit, get refocused, and get ready. And one of the things when I teach kids is I talk about, hey, when you're in school and it's time for a test and you go in, do you have everyone around you go like, oh my gosh, I didn't study, I'm going to fail and everyone's brain just starts to go, and that doesn't make you do very well on your test, right? So if you practice this deep breathing, it's a special secret that will help you do better on your test. So that's one of the ways to engage older kids. For younger kids, one of the things we do, instead of do the hands, is have you lay on the floor, put a little stuffed animal on the kid's stomach, and say, make the animal go for a ride. Put it up, put it down. And so there are ways to engage kids in doing this, and kids really take to this. They enjoy doing it. Next slide, please. So now we're going to practice grounding. So here's a picture. It's easy to kind of look at this picture and go, yeah. But really look at the picture and start to count things like how many petals are on the flower. What all are the things in the picture that are green? Where are there shades of yellow? How many, look at one of the wings of the butterfly and note how many different compartments there are on the wing. So you're really focused on that picture, doing that counting. Let me give you a second to try and count the petals and look at where are all the pictures of yellow in that picture. And what you may find as you do that is, wow, all the other thoughts that were kind of in my brain, I have to kind of let go because I'm so busy concentrating as I count, as I look for things. Another way that we do this is in the moment and where you're at, name 5 things you see, 4 things you hear, 3 things you feel, 2 things you smell, and 1 thing you taste. And again, as you go through that, your brain's occupied in doing that counting and thinking. And so you let go of those thoughts, and anything you can do to make a break in those depressive thoughts, those anxiety thoughts, those overwhelmed thoughts will sort of reset you. And you'll be surprised you can come back to the issue and go like, oh, I feel better now. Next slide. The other thing we look at is what are these evidence-based strategies that mitigate what we call toxic stress? So it's that stress that elevates in our bodies and stays for a period of time, just like the pandemic has caused for us. So these are from our former Surgeon General, Dr. Nadine Burke-Harris, as she and her team put together. And these are all borne out in literature of ways to just reduce that level of stress and release those positive hormones in your body. And that includes getting good quality sleep, balanced nutrition. So we talked about eating and sleeping well, that physical activity, using those mindfulness practices. So the 2 things we just did, the breathing and the centering, actually are mindfulness practices. Yoga can be a mindful practice. You can check off 2 with yoga, physical activity and mindful practice. Getting out in nature. Our bodies, our brains are made for us to be in nature, and there's something calming about that. That can be gardening, walking through a nature trail, going to a park, going to the beach, seeking mental health care when you need it, and those supportive relationships. So you can think about for yourself and for your child, are we doing things in each of those areas, and what are things in each of those areas that are meaningful to us, to our family, to my child, so that I'm practicing these things all the time. Next slide, please. And these are some different mindfulness-based apps that we can use with children. The Sesame Street one is actually for young kids. And again, teaching kids really young, they can carry these with them throughout their life. And, we use it with kids as young as 2. I'm thinking about my friend who had a child who'd get easily upset, and she would teach her child to calm your body. And her child, she would start like this, and then you could be like, calm your body. And she'd kind of, and you could see her do it at 2. So it's something that you can learn early. Then Smiling Mind, Headspace is very popular, and Calm, all apps, and they all have some free components to them as well. Next slide. So you can do all of those things and still be like, oh, I'm a little worried about what's going on with my child. So when would I start to think about maybe I need a mental health referral? So the couple things we look at are, is the problem persistent? So if you're seeing an issue with your child, but it lasts a day, goes away, comes back, in a couple of weeks, that's not what we call persistent. What we call persistent is things that occur pretty much every day and last over a period of at least 2 weeks. And then we're going to start to be like, well, okay, maybe we should take a look at this. Is it pervasive? So does it occur in more places than just one place? Does it occur only at school? In which case, then we might look at the school and see, are there solutions that we need to take there? Does it occur only at home? Well, I might look and say, do we need more structure, less structure? What are some things we might need to change there? But if it's occurring at home, with friends, at school, that's what we would call pervasive and that we would worry about. When things are interfering with tasks of daily living, so I see kids' grades drop, they're not being active with the family anymore, they stop seeing their friends. Those are things that we would start to be concerned about if they persist over time. When kids start to speak about death and would it be better if I weren't here, or I'm giving away things, we should always take those seriously. I know sometimes it's easy to be like, oh man, teenagers, sometimes they're dramatic, or what do they mean by this? But it's one of those things you don't want to miss, right? So we always try and take that seriously and try and understand a little bit about what's going on. And one of the things you can do is, I can assure you, asking, are you thinking about hurting yourself? Are you thinking about killing yourself? Does not put an idea into a kid's head. In fact, they generally really welcome the question. So asking a question back of like, are there some reasons that you're talking about death or that you're giving these things away? Is can be a life-saving question. And then when children have emotions that are overwhelming, where they just can't function, and that occurs over and over and over again, then that's another thing that we would worry about. The child who's like, I had an argument with my best friend and, I can't stop crying. And then a day or two later is like, all right, I'm okay. Or I'm better. That we are not going to worry about so much. But the kid who every day has meltdowns such that they can't do their homework, they don't eat dinner, and it happens continually over a period of weeks, then again, that might be something we want to check out. Next slide, please. And what has CHOC been doing over this time? So, no one organization can meet all the needs that are in the community, but we definitely at CHOC have recognized an increased need. So a couple of things we've done is we've started to put psychologists in our primary care clinics. So as children come in for their routine medical care, if you have some questions like we just went through, you've actually got a behavioral mental health expert right there. And you can come back right to that clinic that you know well and feel good about with your pediatrician to be able to ask these questions and maybe get some short-term treatment. We do have a consultation line where pediatricians can call. So if you come in with your child and you're like, and the pediatricians has a question, they can call and actually reach one of our social workers or one of our psychiatrists. And we have that for schools as well. We do have a mental health education program. We've been going out throughout the community doing talks like this. And over the last 3 years, we've reached over 100,000 people in Orange County and across the country. So we're super excited about that. We've been working more closely with schools. You may have a child at a school that has a well space and helping to support the schools in supporting kids during this time and this, how do I manage during the pandemic? We've added some new positions that can help guide about substance use treatment and where we can find that, because it's a little hard to find sometimes for kids. I think we're in the process for next year of creating a new level of care where we can address urgent mental health problems, but not life-threatening, which would go to the emergency department. So stay tuned for that. expanding our young child program, because a lot of times it's hard to find resources for mental health resources for children under 8. So we'll be expanding those services as well. Next slide, please. So these are some resources, and these will also be put online. These are some resources for on our CHOC website that offer, on our mental health toolkit, that offers a lot of PDFs or information sheets that you can download. And we have information for kids, for parents, for school teachers and pediatricians, and for children and parents. We have them in Spanish and Vietnamese, as well as English. We have some COVID coping specific blogs that you can access at our site with blogs. We have some of our psychologists teaching kids how to breathe, like we just practiced, how to do the grounding exercises, and how to also do guided imagery and progressive muscle relaxation. So you can go online and look at those videos. And then we also have tips on how to cope with anxiety, how to cope and manage depression. And then on Western Youth Services website, we have what's called Project Reset, which has a number of online educational activities for kids, for parents, and for teachers. And those are free. So I definitely urge you to check all of those out. And so that's sort of like, hey, I wonder if, or I have some questions about. Next slide. But also, if there is a time when I am worried about the safety of my child, there are these crisis lines. So we have suicide prevention lines that children can call or text. And we also in the county have crisis assessment teams that can come out to your house or come out to a child's school. And that's 1-866 830-6011, or you can call 911 or take your child to the nearest emergency department. Next slide. And I will stop there. I think we're going to talk about, Cassandra, do we have some additional resources we're going to show?
Yes, so that's going to be the next slide.
Excellent.
There are some duplicate slides. So we have the resources referenced in the talk. So these are in different languages, and so they are available. And then as a reminder, this video will be posted on the Congressman's YouTube page and Facebook page, so you'll be able to access it again. And then we, of course, have the resources for emergency. And then the additional resources for anxiety and depression, as well as different coping strategies. And then we have the resources for therapy and treatment. So we have the county mental health resources, and we have their phone number right there. The Western Youth Services, Child Guidance Center, and as well the County Supportive Mental Health Services for Children and Adolescents. So that's the Children and Youth Services. And then the last one is the resources for child and adolescent treatment. So we have CHOC Psychology, CHOC Psychiatry,
Psychiatry, yeah.
We also have services for Dee Hirsch Mental Health Services, CHOC Intensive Outpatient Program, UCI Child and Adolescent there's that word again for me.
Yeah,
psychiatry. Aspire Intensive Outpatient Program at Hogue, and the Aspire Intensive Outpatient Program Mission. And so those are all the resources we have. And then we are now in our Q&A portion of the session. So if you have a question, please put it in the Q&A tab, and then the question will populate and I will be able to bring it up. So let me stop sharing the screen so I can access the Q&A. I do have one question that came up. One was, what are the different signs that a child can show where mental health is diminishing versus an emergency?
That's a great question. So let me start with emergency because that's going to be the number one thing. So we think about emergencies in mental health of when a child, and we call it a risk to their self. So that means I'm thinking about killing myself. I'm thinking about hurting myself in some way. And I cannot keep myself safe. So a child making threats. A child being a danger to others. So a child making threats about, I'm going to kill you, I'm going to hurt you in a serious way. So that's something different than a child maybe saying to a sibling in the midst of a fight, like, I'm going to punch you or I'm going to hurt you. That's in the midst of a fight. But a child who's like, I'm planning to get this kid would be one that we would think about as being an emergency. And an emergency might also be a child who's saying, I hear voices telling me to do bad things. Those are the kinds of things we'd want to get checked out right away. When we see a child's mental health diminishing, we look at things of changes in behavior. So have my grades drop? So if a child's school aged, am I withdrawing from my friends or family? Am I stopping doing things I used to like to do? So like the child who liked to play guitar, all of a sudden like, I don't like guitar anymore. The child really involved in video games, all of a sudden like, yeah, they stink. I don't like them anymore. We also look at changes in child sleep, in their eating, and like we talked about, in their social relationships. So those are all the sort of things we look at and go, things are sort of going downhill. We also look at personal hygiene. And sometimes those can be hard to distinguish. So that's why it's good to have a mental health provider or your pediatrician be able to guide you a little bit in what's normal development. Sometimes teenagers do neglect personal hygiene as a part of that sort of, being a teenager. But again, is it back to that? Is it persistent? Is it pervasive? Then I'm going to start to worry. But you want someone who knows kids and can start to distinguish, like, that's a normal temper tantrum in a 4-year-old, and this is something to worry about in a 4-year-old. So great question.
Thank you. We do have another question. What conversation should we be having as a family to prevent or assist with our children's mental health issues?
Oh, such a great question. So I think, that's sort of twofold. And I love that families are thinking about, hey, let's make mental health a part of our family conversation, because I think it's sort of hidden in the shadows for a period of time, right? And I think part of our mental health crisis in kids is sort of normalizing, let's have these conversations. So a couple of those things might be even talking about, hey, what are some things you like to do when you start to feel a little like, or butterflies in your stomach, or feel really down? And then you